This term dysmenorrhea is actually been used in layman's language as period pain or menstrual cramp and many more things which have been named as dysmenorrhea. But the scientific term is dysmenorrhea. So it's the pain which is associated with menses or the pain which begins before menses. So and on the larger term, we broadly divide them into primary and secondary dysmenorrhea. Primary dysmenorrhea is the one which usually begins with the onset of first menses. Scientifically, again known as menarche. There are four stages of puberty, pubertal development, and one of them is adrenarche, thelarche, pubarche, and menarche. And menarche comes as the last step in the pubertal development, and that is where the pain usually begins. And the pain is likely to begin in the first year also if it doesn't begin on the first period itself. And usually over a period of time with increasing age and probably once they get married and have a baby, then the degree and intensity of pain gradually goes down. Everybody must realize that sometimes the degree of pain is so phenomenal that a person who is actually suffering only will understand. And what is said is that, especially when it comes to male partners, they what is said is that the male members will not realize the pain of menstrual cramps. You can quantify them. Not everybody suffers with grade for dysmenorrhea, but there are, say, maybe around 20-30% of the patients will have severe grade 1 or very severe dysmenorrhea, where they actually remain, they go crazy, they cry, they remain in their shell, they don't want to come out of a room, and all sorts of things. They will not go to the school, they will not go to work, and the female partners in the house, they have to sympathize with them, they have to be with them. Counseling is very, very important, and even if it is part of your routine, it's something which needs to be taken care, so either by medication or for whatever means. There is something called idiopathic dysmenorrhea or primary dysmenorrhea, which is commonly seen in young girls, which begins at menarche and then gradually starts getting lesser and lesser. So quantification wise, they start feeling better as the age advances. But any patient who comes to you, probably you will have to do a thorough examination and do some basic investigations to confirm that there is no associated pathology inside. So in absence of an associated pathology, this is something which will not really harm them on long-term basis. But at the same time, you need to give her pain relief. So every month that she gets pain, you need to be, because otherwise their entire activities are affected, day-to-day life is affected, their education is affected, their services are affected, and it takes a toll on their marital life also. So that is something which need to be taken care. Even if there is no associated cause, the quantity of pain sometimes is so much, so phenomenal that we will have to address that issue. The doctors will have to address that issue. What really works is counseling, behavioral therapy, little adjustments in their life and exercises, and you need to understand that this is the pain which has to be taken in the stride itself. So whatever is the degree of pain, what you can bear, you should not take medication. What you can't bear, then you take medication. So you should be pain free, or you should be reasonably good, and your day-to-day activities and work is not really covered. That is how. So it is purely symptomatic. So it is something which you don't treat a disease and then the patient will be cured, because in primary dysmenorrhea or spasmodic dysmenorrhea, what it is called, it is not necessary that there is a presence of a disease. It's a normal physiology. The campaigns can be done at schools. There has to be, social visits to the schools by the doctors and counseling about menstrual hygiene, and dysmenorrhea is part of menstrual hygiene that
Right.
you need to be taken care of. And the headmistresses and the
Right.
lady teachers in the school, they can have group discussions. The NGOs are there, so there are many avenues. But all that we need to remember is that this is just an initiative. The
Right.
task is hurricane,
Yes.
and
Yes,
the beginning is good, but it has to be carried on and it
Carried
has to
on.
be sustained and maintained.
True.
It'll
exactly.
take years for us to really achieve the goal. Yes,
Yes.
yes, yes, everywhere.
Yes.